today, whatever we already learned, some of them, what is axial skeleton, what is appendicular skeleton. Now we have to go a little bit more in there. What are the different bones in there? I am telling you, not all very important. I am going to tell you whichever is more important, and you can write it down. Nobody is going to ask you different types of bone structures, but which are going to be focused, I'll tell you so that you can get the knowledge. It's not like that I'm not going to teach you what are the who is it's better to know our different structures, different body parts in details. But at the same time, I'm going to focus which is more important for your exams as well as if something is more important for your profession. As we already told, axial skeleton from head to toe, except the appendages or the hands. So it's called the longitudinal axis of the body lengthwise. So forms the longitudinal axis of the body, and it has been divided in three parts. We have skull, we have back in the vertical column, and in the front we have the bony thorax. Because after that you have your leg, that is your appendage, and your hands are the appendage. So except the appendages, the other longitudinal axis of the body is called the axial skeleton. So what is that? Our head, which is skull, we have vertebral column, which gives you the back support, and your bony thorax. Why it's called the bony thorax? Because thorax is covered by the bones, the ribs. So that is called the bony thorax. So these are the thing. This is the skull. This area is the vertebral column from top to here. This is the vertebral column, and here this is the bony thorax. This is the thoracic cage, which the ribs cover your thoracic cavity as we go from the beginning. And these are the appendicular skeleton. It starts from here. So it supports from here to here. That is in the longitudinal axis. And that is from the back side, that is from the front side, and that is from the back side. We are going to see the same thing, skull, vertebral column, and this area is the bony thorax, front and back view. Now the skull. What is the skull? Skull means not only this area, right? Skull means it includes the total face and your head bones. So that's why it said skull had two sets of bones, cranium and facial bones. So skull is under axial skeleton and it has two sets of bone. What is the cranium? What is the cranium? Which houses the brain or protects the brain. What type of bones it has? What type of bones it has? What nature? We studied yesterday.
Flat bone.
Yes. And
It's
what type of
flat.
nature? What type of nature or what the character?
Nature, I can't remember that now.
Yeah, spongy outside and compact inside.
And rigid, compact. Yeah.
Compact inside. Now we repress, right? So yeah, that's the thing because you need to give the shock protection at the same time. It's hard to keep the brain inside protect. And you have the facial bones. So what is sutures? Like when you have been in surgery, they joined the skin after the surgery with the suture, right, to keep it together. So bones are also, there are different parts of small bone. If it is a one bone, it will be straight, flat, curved. But bones need to be structured, joined, small, different parts of bone. They are need to be, but we are not joining it. It's joined during the development. So bones are joined by sutures. This you can remember, okay? Bones are joined by sutures. Okay. But only which bone is freely movable is the mandible, that lower part, so that you can move the mouth to open and eat. Okay. Upper portion of the brain, the maxilla, is fixed. You can see the lower portion. When the jaw, you cannot move the upper jaw. You can only move the lower jaw. That is the mandible. And that is freely movable joint in the skull. Okay? So here you can see how it looks like. Why they call, these are called the sutures. So whole skull is made up of, there are small piece of bones. When it's covered, it's called the frontal bone. When this is the rounded structure in the covering from the front to back part of the back, it's called the parietal bone, and down it is called the it's called the occipital bone. And here there is another bone, it's called the I think temporal bone. Yeah, this is the temporal bone. Temporal bone is beneath that. So frontal, parietal, occipital, and temporal bone. And how, see, the facial bone, these are connected each other by the sutures. This connection is called the suture. You doesn't need to remember all the sutures name. This is the coronal suture. This is the lumbar suture. There are different type of sutures, the name. So you doesn't need to. And this is one bone is there. Another one. So it's called the sphenoid bone. Here the eye, it holds the eye. That's why it's called the lacrimal bone. This is the mandibular bone. This is called only the freely movable. This can free move. You cannot move the up. Whatever you are opening and closing your mouth is mainly by the movement of the mandible. This has some gliding movement, but you cannot go up. Only this is, you can open and close. Okay, so this is the total skull facial bone. This is the facial bone, and this is the bone of the cranium or the skull. Okay, so we have nasal bone, we have different things, and obviously maxilla and mandible. This is the different slice, different structures they took to show you. So this is the mouth. In the ears, you can see the upper maxilla in the gate. This is the upper part of our mouth. It is called the, it's a hard palate. It's called the palatine board. These sometimes questions come. What is the name of the hard palate in our, what is called facial bone? Those are too much. Palatine bone. Okay. So this is the in the palate, and hard palate is located in maxilla part. Okay, the upper part. And mandible part is down, is freely movable. Okay. So now how it looks like when we are covered with muscles and this and that. This is the same thing they are giving you in different views. This is the nasal, is the our upper inside is open. This that's the whole nostrils and is going to the nasal passage. Okay. So it's called sinuses. What are the sinuses? You know we have the sinus, we have the sinus pain. What the sinus? Hollow portions of the bone surrounding the nasal cavity. So this is the nasal cavity. There are different type of sinuses. We are going to see it. So you have some hollow position. That means it's hollow where the fluid can deposit and give you the pressure. So functions of the paranasal sinus. What is that? Because hollow means there is nothing. So it's lighten the skull and give resonance and amplification of the voice, because after that you are breathing, you are talking is going to the larynx. So air when it's passing through the larynx, it produces the sounds. So when you have the different hollow structures in the nasal area, nasal cavity area, it gives the air and go and give produce different type of resonance so that you can produce different types of voices. It's not that much important, but paranasal sinuses are hollow portions of the bone surrounding the paranasal. When it comes to nasal, it's related to nose. Paranasals, which is the hollow structures or the cavities which count surrounding the nasal cavity. So remember from here you cannot remember what is the sinuses means hollow cavity or hollow portions in the bones. When is paranasals is surrounding the bone, that you have to remember, and the function is light in the scale. So you can see where you have the this is you have the nose, right? So you have one here is called the, you doesn't remember to know all the names, but see how the sinuses, and you can see, or whenever you have the migraine or or you have sinusitis, inflammation of the sinuses, so then you feel the pressure here because the fluid feels there and gives the pressure. So generally we have four sinuses in the front. Sometimes you have very bad headache just above that one in the near the eyebrow. Sometimes you have lot of pressure pain near the eye side and obviously down. Sometimes the allergy also cause inflammation. These are from the side view. Okay, what is the hyoid bone? So after anatomy and physiology, everybody is going to be the orthopedics specialist. Somebody is going to be the muscle specialist, nerve specialist, everything. My God. So what is the hyoid bone? What is the characteristics? It is not articulate with another bone. Articulates means it's not joint. Okay, all bones are joined with each other, but the only bone that doesn't articulate with another bone. Okay. So what it serves? Serves as a movable base of the tongue. It's in swallowing and speech. See where the bone is here. This is the structure. It's floating. So that when you are swallowing something, it helps you to swallow so that it doesn't give you the resistance. It's the hyoid bone. Now we come into the fetal skull. So fetal skull is large compared to the infant's total body weight. So that's why if the when during the birth, if the skull can come out, the body can come out. Skull is huge in compared to infant's body length. So what is 1/4 of the body length compared to adult skull in which 1/8 of the body length? Our skull is 1/8 of the body length. For the fetal skull is 1/4 of the body length. What is the fontanalis? These are the fibrous membrane connecting the cranial bones. That time the suture is not developed totally. So that's why you see the baby up to the 6 months, their head, everything, you can see the head. Upper part of the head is also very soft because it's not sutured properly, because the baby has to come out and inside the womb, baby is have to squeeze or take the form like you see. So what instead of completely make the suture, fibrous membrane connecting the cranial bones. All the cranial bones, the bones of the skull, they're connected with the fibrous membrane. What it does, what I tell you, skull allows skull compression during birth because skull is huge. Sometimes it's very hard to come out the skull. So if there's a fibrous membrane, membrane can squeeze. But if it is sutured, it cannot squeeze because it's a structure, bony structure. Also allow the brain to grow during later pregnancy and infancy. So that's why up to 6 months the babies, nowadays 3 to 4 months is okay, but the 6 months it says is very careful, because when you take the baby also you have to see, you have to the back support near the neck because their till is membranous, it's not sutured completely bony. So that's why if it has the membranous, it gives the skull to grow, the brain will grow, when the brain will grow and mature, obviously skull will grow. So, and then convert the bone within 24 months after birth. So it takes to become totally compact and bony. So 22 years. So these first 2 years are very important. So that's why if the baby gets hurt or anything, there is a chance immediately it can affect the brain. So that's why even if and this is the time the kids fall down either from the bed during play or something like that, and their head is getting hurt. So it's very important so that the baby doesn't get hurt in the skull region. So these are the all the this is the frontal bones, parietal bones, as we learn, all this that, but these are membranous cartilage. This is the baby. See, all bones are there, but these are not sutured. You can see it's not sutured. It has a membrane cartilage in between so that they have the space to grow. The membrane can grow, it they can grow. Now we're coming to the next structure of your axial skeleton. It's the vertebral column. We have 24 single vertebral bones in our body, and each vertebra has their name as per the position or location in the body. These vertebrae are not connected to each other. They are separated by the intervertebral disc. So what is that? We have 7 cervical vertebrae are in the neck region. We have 7 cervical vertebra. We call the C vertebra, and they have named C1 to C7. We have 12 thoracic, which is from the neck to the thoracic region. 12 thoracic, and it has been designated as T1 to T12. And then we have 5 lumbar vertebra, which is all the lower portion, and there has been named as L1 to L5, that is in the lower back. So we have 12 thoracic vertebra in the thoracic or chest region. Lumbar vertebra are located in the lower back, and cervical vertebra are located near the neck. In the down, where do you have the lumbar? So 5 lumbar and 2 thoracic. So 9 vertebra fuse to form composite bones. And the down, where we are the near the tail end is called the sacrum and coccyx. What are those? See, this is the lumbar L1 to L5, and then we have this structure, right? So coccyx, 4 of them fused to from the coccyx, and 5 of them fused to from the sacrum to give you better support for your sitting position. So these are the vertebra. We call this is the cervical vertebra 1, 2, and up to 5, and thoracic vertebra number 1 to T12, and then we have the lumbar vertebra L1 to L5, and see each are separated by a disc is called the intervertebral disc. Okay, so give the support, and vertebra you always need beam, so it cannot be fused with each other, right? It needs the flexibility, because you are bending getting straight, bending getting straight. Otherwise, if the fuse is like a stick, you cannot bend, you are always straight. Sometimes we feel, yeah, if we have that one, we can, the curvature has gone, but it needs the curvature and bending.
Yes.
Yes.
Do we need to know that, Dong Pak?
Which one?
The T1 to
No, no,
T12.
no, 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 no. I told you. I just showed you. So you can
Okay.
remember. Yeah, you just only the cervical vertebra is in the neck region, thoracic
Okay.
vertebra in the thoracic region, lumbar vertebra in the lower back. But you have to remember what is the coccyx and sacral.
Yeah.
Okay,
Okay.
coccyx is fused by 4 vertebrae and sacrum fused by the 5 vertebrae
Five.
at the lower end. That's all. Oh, no, no,
Yeah.
no, it's too much to remember.
Yes.
And what is the intervertebral disc? So that is the separated the vertebra with each other. Okay.
Thank you.
Yeah, let me read. And what is important: primary curvatures, vertebral column, and the spinal curvature, the thoracic sacral regions present from birth, C-separate curvatures, the newborn secondary curvatures. So that's from here. Only one thing is important. Our total vertebral column has a C-shaped curvature. In the C-shaped curvature is okay. So C-shaped curvature, yeah, during the birth and very young stage. In the adult, it became S-shaped. See here, and then skin like so. In adult, the vertebral column is S-shaped structure, and in young or the very newborns, it's C-shaped. Okay, the vertebral column structure in the young, the newborn is C-shaped, and ultimately it is turned to the S-shaped in the adult. My God. To be honest with you, you doesn't need to know the different structures of the vertebrae. It has a body, vertebral arch, pedicle, lamina, vertebral foramen, transverse process, spinous processes, superior and inferior articular processes. These are too much information, but you can see what are the structures I'm telling you, but it is not going to be very important for your exam. That I can tell you. Yeah. Don't tell one, Moon told that one, so that we didn't read it. Okay. Yeah. But it's true. So how does vertebral arch?
Thank you.
Yeah, what are the different structures? So there is a hole, it's called the foramen. Why all vertebral they are connected with each other, intervertebral discs and vertebra stack one upon another. There is a hole in middle. What is the hole is there? Why?
Spinal cord.
That is where the spinal cord passes
Yeah,
through.
spinal cord and cerebrospinal fluid is there. Spinal cord pass through that. That's the vertebral foramen. The passage of the spinal cord, and also it houses the cerebrospinal fluid. What is the cerebrospinal fluid? The fluid which comes from the brain and it fills the total spinal cord. That's is called the cerebrospinal. These are the different structure. This is Sam has projections. It has some arch. These are called the spine's processes. This is called the lamina, which is connected from here to there. And this is called the actual body. And here is connected with the bony structure is called the pedicle. And this is the main important vertebral foramen. Any foramen is an opening. When the is where it is located is giving the name. Vertebral foramen is the opening inside the vertebrae. The two cervical vertebra is very important. This is one is atlas and axis. Atlas, these are not going to come in the questions, but I am telling you just for knowledge. The atlas and axis. Atlas is number one, just after our skull, the cranium. The atlas is the first one, first vertebrae, and second one is the axis. This is the two vertebrae. What is the importance of the? This is the see the each vertebrae is different. They didn't. You can see one process here. It doesn't have everyone. This one. This is called the spinous process. If somebody hangs, what happened? This process, like a knife, it goes and cut off your spinal cord. That's why you are dead immediately. How it's there? Because intervertebral disc is there, right? It can go there and it cut the spinal cord. So when somebody is hanged, it happened like that. This is the spinous process. This is the very, that's why it says very important when you are holding the baby when they are, because their bones are still not bony. So very important to give the support in the neck area of the baby. And also adult, very careful so that it doesn't give the pressure in such a way that it can damage the spinal cord. So different vertebrae has different shape, different parts. You doesn't need to do that, but just showing you how the thoracic vertebra look like, how the lumbar vertebra looks like. See, each are different from each other. This is the thoracic vertebra. This is the lumbar vertebra. Now sacrum. We already told formed by the fusion of 5 vertebra, and coccyx formed by the fusion of 3 to 5 vertebra is called the tailbone. What is the another name of tailbone? That is important. That may come. Okay. So tailbone, why is called? This is the remnant of a tail. This tailbone is very prominent and developed. This is here is became remnant structure, but this tailbone is the remnant of a tail that other vertebrae have, like the dog, cat, everybody. Their tailbone is long and is flexible, but ours is fused. But it's the evolution that we have evolved our previous ancestors or some kind of animal, that the orangutan or chimpanzee, and go down the hall is more back. So how it, this is the sacral zone, sacral canal, but still the opening is there from where the spinal cord will go. So it looks like that. It has been fused by 5 vertebrae and looks like a container. And then, okay, so that's the, and then the coccyx is fused by 3 to 5 vertebrae, depending on that. So coccyx, the another name of coccyx is tailbone, or the another name of tailbone is coccyx, fused by 3 to 5 vertebra. Sacrum is fused by the 5 vertebra down. Now, bony thorax is a cage protect our upper major organs. It has consist of three parts: sternum, ribs, and thoracic vertebra. Thoracic vertebra is in the back, so now it's coming total in the form of the bony thorax. We have a sternum. You have shown yesterday the flat bone in the front. We have the ribs, and we have in the back is thoracic vertebra. So from the thoracic vertebra to the sternum, ribs are connected from front to back to give a box or cage, thoracic cage. We have ribs, true ribs, 1 to 7 pair, false ribs, 8 to 12 pairs, number 8 to 12, 4. True ribs, number 1 to 7, false ribs, 8 to 12 number, and floating ribs, 11 and 12, 2. And we have the thoracic vertebra. See how the rib cage looks like. So exactly this is the cartilage portion, right? We have remember because to give the opening and chest so that expand and contract as per we respire. This is the sternum. We doesn't need to know the name different parts of the sternum. It's a flat bone sternum. This is in the back of this. This is the thoracic vertebra. So it's connected from the thoracic vertebra to the sternum. So what is that? We have true ribs 1 to 7. 1, 2, 3, 4, 5, 6, 7. True ribs. These are called the true ribs. And these are called the false ribs. Because it's not, why it's not false rib? Because this is not connected. True ribs means it's connected with the sternum to the vertebra. See. 1, 2, 3, 4, 5, 6, 7. These are connected here. Remember with the sternum to the thoracic vertebrae. We have 4 false rib because these are not connected directly to the sternum. They are connected with the one by one serially. So T8 is connected here with this one, with the 7, then 9, 10, 11, 12. They are connected to each other with the hyaline cartilage. So that's why it's called the false ribs. And we have 2 ribs hanging here. It's called the floating ribs. It's not only connected in the vertebrae, it's hanging, supporting in the back. It's clear now? It's interesting to know, but too much information for the exam. Am I right?
Yes.
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 Yeah,
But yeah, it is interesting.
yeah, yeah. You can see how his body, how his our ribs, why is happening, why you can expand, why you can do that, why how you can bend. Yeah, so everything. Okay, so
Amazing.
yeah,
Amazing how the body
amazing.
works.
Yeah, yeah. Then the appendicular skeleton, we have total how many bones?
6.
206. Yeah,
206.
yeah. In the appendicular skeleton, we have 126 bones. Rest are in the axial skeleton. They are not going to ask you the plus or minus. I'm just telling you for our audience. So 126 bones are composing your appendicular skeleton. As we know, we have appendicular skeletons composed of limbs, pectoral girdle, and pelvic girdle. Okay. So what are those? These are the appendix. This is the pelvic girdle, which guards our lower portion, lower, and we have the, what is it? See, sometimes, and pectoral girdle. We are going can see that from the back. So what is supporting from the back? That is the in the pectoral region. So you can see in the front. These are the limbs. We can see the pelvic girdle from the front. See from the back. This humor, the upper limb bone, is connected with the flan-like structure. Okay, this is called the scapula. So this
It's
is also
shoulder bone.
uh,
Shoulder bone,
shoulder
scapula.
bone, scapula and clavicle. Both are shoulder bone. So they are connected with the supporting from the back of the ribs. So this is called the, they are guarding. That's called the pectoral girdle. And this is from the down is called the pelvic girdle. So pectoral girdle or shoulder bone, which is composed of two bones, as I showed you, clavicle and scapula. Clavicle is called the collar bone. So you can see in the front also, this collar bone is going to be very important to locate when you can feel it. The top one, you can see that is the collar bone is going from here to your near the hand. That is the front. That is called the clavicle. Is going. This is called the collarbone. Is near the collar. Okay. This collarbone is going to be important when you are going to learn the ECG, because you have to first identify the collarbone and then you have to go to the ribs to find the perfect placement for the ECG leads to do the ECG. So collarbone is in the top. Is in the, is said, articulates sternum medially and with the scapula laterally. Okay. So here it is articulate. This is the sternum. So it's articulate means it's joining with the in the front with the, this is the collarbone is joining or articulating with the scapula. Oh, sorry, is articulating with the sternum in the front, and in the back is articulating with the scapula. See, here is the scapula is articulating here. And scapula is the shoulder blade. Is another name is the shoulder blade is the scapula. It articulates with clavicle and articulates with the arm bone at the front. So this bone, the scapula is only from the back, but clavicle is going to from the back to front. So in the back is connected or articulated with the scapula, and in the front is articulated with the sternum. That is called the collarbone. But the scapula is only the fan-shaped or blade which is articulated with your hand bone is called the humerus, and in the back here with the clavicle. So that is the basically the pectoral girdle. These bones allow the upper limb to have exceptionally free movement. Scapula, you can see when you are moving your hand is gliding. It give you the movement. This all the scapula looks like the fan-shaped blade size structure. Here is articulated with your hand bone, the humerus. And this is connected with the back in the clavicle. So now we are going to go to the upper limb bones. Upper limb bones, we have the humerus. It forms the arm, is the single bone. Proximal in articulation. Head articulates with the glenoid cavity of the scapula. Glenoid cavity, the notch, where it attach, that is called the glenoid cavity. Distal end articulation, trochlea and capilla. Doesn't need that one. Okay, so I can show you here. See, it's called the head of the humerus. This is the long bone. It is keeping attached with the scapula, which is called the, how it gets attached in the scapula. There is a notch type structure. This is called the cavity, glenoid cavity. and in the distal end is articulate with the other bones. Let us go. So it's called the here it's called the trochlea. You doesn't need to know all these things, it's too much. But see the structure, how it's this is the head portion and this is the bottom portion or the distal portion. This is the proximal portion, this is the distal portion. In the upper portion, the head is attached with the scapula and this down is attached with your elbow bone or ultimately radius and ulna. So now the forearm. Now this is called the upper arm bone, okay, humerus. Now the forearm we have or the upper limbs have two other bones. It's called the ulna and radius. That's all. You doesn't need to know any more than that. So this is the radius and ulna. Okay, these are the two bones. They are attached with the humerus. Now hand, we have, this is the hand, we have small bones. Remember we have told you the small bones. So we have the hands, we have the which bones, carpal, metacarpal and phalanges. Carpal is the wrist bone. Metacarpals are the finger bones. 5 per hand. Your fingers, you have 5. And phalanges, oh sorry, is my mistake. Carpals is the wrist bone and metacarpals near the palm, near the hand. You have 5 per hand metacarpals because they are going to end up in the fingers and we have 5 fingers. The fingers bones are called the phalanges. Okay. You have 14 phalanges in each hand. In each finger there are 3 bones, 1, 2, 3. In the thumb only 2 bones. The thumb is short. You can see the structure, learn it, but it's not important. Only you have to remember phalanges are the finger bones, metacarpals are the palm bones, and carpals is the wrist bone. That's the set. This is the radius, the lower arm is connected here with the carpals, that is the wrist bone. Wrist bones is composed of couple of small bones. Then we have the metacarpals. How many we have? 1, total 5 for the 5 fingers. So we have 1, 2, 3, 4, 5. And we have the phalanges. These are the finger bones. In the phalanges, we have 3 in each, except your thumb.
Thumb.
Thumb has only 2 because it's small. Okay, that's true. Good. The bones of the pelvic girdle. What are the bones of the pelvic girdle? Is the down one, formed by 2 coxal bones composed of 3 pairs of fused bone. This is the only just you need to know what bones composed of the pelvic girdle: ilium, ischium, and pubis. Okay. You doesn't need to know all these things, how many bones has been the pelvic girdle, bony pelvis. So just remember the pelvic girdle is composed of 3 pairs of fused bone: ilium, ischium, and pubis. And those are very important structure because total body weight, upper body weight, that is the main body weight, rests on the pelvic. So it protects several organs. It protects your reproductive organs. That is important, which the pelvic girdle protects. That is our important part. Pelvic girdle protects your reproductive organ, your urinary bladder that is there, and part of the large intestine, because your rectum and other things is in the down. So part of the large intestine. This is important. So this is your pelvic girdle. Okay. So this structure is called the pubis. This again the fan-shaped kind of structure. It calls the ilium. It looks like a basin, right? And the small one is called the ischium. Okay. And here you have a symphysis. You doesn't need to know a lot of that. And here you can see this is here your vertebral column, the last part, the sacrum and coccyx coming down. So how the whole body is connected with each other. This is the vertebral column is coming out, giving the support to the end with the tail, and here is holding from the back our urinary structure, your reproductive structure, part of your large intestine, including the rectum, in down with the fusion of three bones: ilium, ischium, and pubis. So this is the side view. So what is the difference in the pelvic bone? Obviously, that I'm going to tell. Then I said, okay, the female inlet is larger and more circular, right? So female pelvis is whole is a shallower and the bones are lighter and thinner. You doesn't need to tell that. It's too much information.
Yes, it's almost break time.
What is the time now?
10:15.
Oh my God, you are our timekeeper.
What? How many slides we have here?
We only have few slides.
Few slides. Let me complete this one. Then you can go
Okay.
for break. Is that okay?
Okay.
Yes, ma'am.
Yes.
Okay. Yeah. Okay. So
Yes.
like you see, I am just pointing out which is the important. I am not talking the too much. Okay. So the femur, we already know you already talked yesterday. The lower limb bones is upper lower limb bones. So we have lower limb two parts, right? Upper and lower. So upper lower limb bone is called the femur, or the another name is thigh bone. Okay. We call generally name is thigh bone. The name of the thigh bone is femur. This is the heaviest and strongest bone in the body. Okay. Because all body weight and everything goes in here. Okay. You doesn't need to know that distal articulation, frontal articulation. This is the femur is the upper limb bone. Is the single bone, and it is the strongest bone in the body. Fine? Okay, note it down. The lower limb bones has two bones. Tibia is called the shin bone in the front, large and medially oriented, and fibula, thin and stick-like, lateral to the sorry, lateral to the tibia. So, but the tibia shin bone is articulated in the knee joint with the upper femur, but fibula has no attachment in the contribution in your knee. So this is how it looks like. So this part is connected with the knee portion or the patella portion, but this is called the fibula. It's like a stick. That's why most of the time these bones become cracked easily. So tibia and fibula. So they are the two bones of the lower limb. Okay, lower limb. So name like the same thing. We have the hand. We have the foot bones. We have the name of them at the tarsal, metatarsal, and phalanges. Exactly the carpal, metacarpal, phalanges. Like the hand is only carpal, and in case of feet, is called the tarsal. You doesn't need to know so many bones are there. So just remember we have the tarsals, metatarsal, and phalanges. Tarsal is mainly the ankle bone, and then tarsal here, and then the phalanges here. So this is is called the three bones. We have the tarsal, metatarsal, and phalanges. So arches of the foot, which is mainly bones of the foot, are arranged from three strong arches. Don't need that one. This one arch. This is the mainly the from the ankle bone. Joints. We have couple of different types of joints. Articulation of bones are called the joints. What is the function of the joints? We all understand. Holds the bone together and also allows the mobility. There are two types of joints, functionally and structurally. Functionally, which allows the mobility or the movement, and structurally, which holds the bone together. So holds the bone together, they are structural part, and allow the mobility, that is the functional part. So what are the immovable joints, which are the fixed joint? There are a couple of joints which it cannot be fixed, like in the skull, the
The
bones.
sutures.
Yeah, what is come with the sutures, permanent. The name of the synarthrosis. These questions are not going to come, I'm telling you, but they can ask you how many different types of joints is that: immovable joint, slightly movable joints, and pre-movable joints. So we have three types of joints: immovable joints. What is the good name? Is synarthrosis. Even I cannot remember. Then amphiarthrosis and diarthrosis. This is the free movable joints. These are the three joints. Who are the bone specialists, they can do that. But this is important. Fibrous joint, these are immovable. Cartilage joints, movable or slightly movable. And synovial joints is freely movable. So our knee is synovial joint. That is important to remember. Knee, the movement, the elbow, that is the, we are called the synovial joints, which can move free. Cartilaginous joints, which is we have in the sternum, in junction of the sternum and the ribs. It can move a little bit free, like little, slightly movable. So when you are inhaling, you can expand the chest, little bit movable. And some are immovable, fibrous joints, where we have the really, really compacted structure. Also, cartilaginous joints, you can see here where the vertebra needs the expansion. We can see here cartilaginous joint when the ribs need the expansion. This is the cartilaginous joints. And free movement here, free movement here, free movement here. This is the our free movement joint, or the, yeah, this is the cartilaginous joint again here. Synovial joints, we already told, articular bones are separated by a joint cavity. And synovial fluid is found in the joint cavity, means is in the patella, in the here. There is a cavity because you need the free movement of the hand, you need the free movement of the feet, you need free movement here. So these are called the synovial joints and is filled with the fluid here. The what is bursa? That is, you can hear the name of lot of things, bursitis, wherein the inflammation of the bursa or fluid filled with the bursa, that's called the bursitis. This is the sacs, fibrous sacs lined with the synovial membranes. So synovial cavity is there, it is covered with a membrane and it's filled with the synovial fluid, so that give you the cushioning, no friction, avoid friction when you are moving the knee. That's why when you lost the synovial membrane or cartilage, it creaks. It gives you to help with the lubrication. That is the bursa. Bursa is the membrane which is covering the synovial joints. So flattened fiber sacs, which is the synovial membranes, and filled with synovial fluid. This is called the bursa. Tendon or sheath, elongated bursa that wraps around a tendon. Doesn't need that. So you can see it's a membrane, right? Here is the cavity. Synovial cavity is in the sac. You have the fluid, like you have the padding. That is the bursa. And you can see the synovial membrane is covering this one. This is the synovial cavity, and this is the bursa. Where it has, they're showing you in different places. What is bursitis? I already told some conditions associated with the joints. Bursitis, inflammation of bursa, usually caused by the blow or friction, inflammation. Tendonitis, inflammation of the tendon sheaths is called the tendonitis. Arthritis, inflammatory or degenerative disease of the joints is called the arthritis. There are over 100 different types of arthritis, and this is the one of the major cause throughout the world nowadays. Initial symptoms: pain, stiffness, swelling of the joint, and ultimately everything is cracking down, breaking down, need the replacement. What are the different forms of arthritis? These are important for your questions. Osteoarthritis is the most common chronic arthritis related to the normal aging process. What is the rheumatoid arthritis at autoimmune disease? When your own immune system attacks your joints. Symptoms: it started with the bilateral inflammation of the certain joints. If it is the left and right, it's going to be affected in the both sides. If it is affecting the elbow in any joints, it's the bilateral. And it often leads to the deformities, means either it's going to grow out and extra growth, so it causes the deformities. But osteoarthritis is the chronic arthritis, most common arthritis is very pain, stiffness, bursitis, everything. So osteoarthritis, rheumatoid arthritis. So this is, you can see how it is happening. And what is gouty arthritis? We know we have the gout when there is a deposition of some uric acid crystal that cause the inflammation of the joints. In the joints, if there is a deposition of uric acid, it gives you pain, like you feel the needle is pinching you. Sometimes the outside you can see the red in that area where you have the gouty arthritis. This can be controlled by your diet. It is very common in men, but females are also getting affected with that. But the males are suffered more with the gouty arthritis. But it can be controlled with the diet only diet. So this is important. All these arthritis are important. These I already told you. In the fontanelles are completely replaced with the bone with 2 years. That is the fibrous membranes, right? The bones are joined with fibrous membranes called fontanelles in the child. Okay. And so how the C, what we told the ribs is C structure, and the adult is going to change to the S shaped. So you can see all the structures is going the free movable joint, mandible joint, and then is fibrous bone frontal. So these are not sutured. So these are the fibrous structures which allows the bone to grow, and finally it became bone after 2 years of birth. So skeletal changes is called the, we remembered yesterday we called where the growth has in the epiphyseal plates, right? Where the bone grows in the epiphyseal plate. Okay. So adolescence throughout the life. It mainly in the adolescence, still up to adolescence, the epiphyseal plates become ossified and long bone growth ends. This is the structure. 2 years old, skull is larger in proportion to the body. 8 to 9 years, skull is near about the size and proportion. Between age and 11, the face grows out from the skull. Mainly, you can see. You doesn't need to remember all those things. This is the structure, how the newborn, there you can see their face are more raised, but slowly the mandible in the is getting go outside. See how the face is slowly is coming out. Curvature changes. Curvature can changes throughout the life. Our spine, when you are young, our spine are straight, and slowly we become like front is going to be more. So primary curvature are present at birth at C, convex. Secondary curvatures are associated with the child's later development, convex anteriorly, and S, the in the adult is S separate. That's why I tell that. So sometimes our spine is like that, but it sometimes it has been moved here and there. There are a couple of skeletal changes. What is osteoporosis? Bone thinning disease. That is the bone thinning disease is osteoporosis. Bones become thin due to lack of either hormone PTH or your calcium or phosphorus. So this is the due to age. So is generally when females 50% the women over the age of 65 got the osteoporosis because estrogen is main supporter for the ladies for keeping this bone good. So after the menopause, they got mostly associated. It started before also, but 20% of the men over 70 got this one. What is that? Makes bone fragile. Bones can easily fracture. Vertebral collapse result in kyphosis, also known as the Dower's ham. That is the back. Estrogen aids in health and normal density of a female skeleton, as I told you right now. So you can see age 40, how you are straight, and then slowly age 60, you are getting down, and you can see the bone is getting damaged, and slowly I am in this age now, not even not age, but I am always looks like this from my knee. We bent forward, and that's all. Oh, good. Thank you. Okay, so you can go for break now.
Okay, thank you.
Miss, what time are we back?
What time you want to come back?
20
11.
minutes?
Huh?
Is it 20 minutes break still?
Okay, sure. Go ahead. You guys
Okay.
are very good listener, good students, so it's okay. I can give you to refresh your brain.
Thank you.
Thank
Thank
you.
you.
Okay. Alexia, what happened to you? Are you till in or not?
Sorry?
Alexia,
Yes.
where you are?
I'm here.
I called you in the morning. Where you were? I didn't get you.
Sorry, I think I missed the attendance. I came in after.
Okay. So you're 20, probably 30 minutes late, right? Approximately?
I think so. Mhm.
Yeah, okay.
I am Ina. Yes, indeed.
Hello, everyone is back. It looks like a couple of people are not back yet. Hello, Luis. Hey. I saw you are putting your head this side, so that's why I said, hi. Okay, so who is missing till now? Sabana. Okay. Please, guys, come back. Team. Yeah, close file. We are very good with team. So all your ethics marks is updated in D12, and somebody is going to update it in your campus login.
Sorry, miss, I didn't get that. What were you saying?
I said in the D12, your ethics marks has been totally updated, okay?
Okay,
But
thanks.
somebody is going to update little bit update in the campus login. Campus login, there is some problem in the when I update it, there are some screwed up. So I send all the updated marks from the D2L. So they are going to there you may see some discrepancy between the campus login, your portal, which is what is your campus call login, what you call there versus here. So what are the D12 marks is final, and they are going to update it in your campus. Okay.
Yeah,
Okay.
I saw my
Thank you.
grade already in the campus login.
The campus is not
Thank you.
updated till yet, I guess. But I told somebody to update in the campus login. I don't know whether he did it or not. But you can.
I saw it already, ma'am. Mine.
Okay. Okay.
Yeah. Thank you.
You're welcome. Now let us watch the video of this one. Okay. Whatever I learned. And then I'm going to go to the next slide because this is a 125 slides again.
Miss, we're not hearing anything. So I don't know if you already upload the video. Miss,
Yes.
do you know that the video is not on?
Oh, I don't know. Sorry.
Yeah, it's not
Sorry,
on.
sorry.
That's okay. Thanks.
Okay. Nobody told me. Or do you guys told me I didn't hear
I
it?
tried, but I don't know. I tried the first time, but that's okay. Go
Okay,
ahead.
okay. Let it do that.
Yes, we thought that you're
Okay.
In
still
March of
busy.
2015,
Okay.
American astronaut Scott Kelly and his Russian colleague Mikhail Kornienko began an unprecedented mission in space. They began a one-year term of service aboard the International Space Station, the longest tour of duty ever served on the ISS. Now, I imagine there's all sorts of stuff to worry about when you're packing for a year-long space voyage, like, say, how many books should I bring? How many pairs of underwear? Am I really okay with pooping into a suctioned plastic bag every day for a year? Will I come upon a derelict ship haunted by some stranded and insane astronaut from a forgotten mission, like in pretty much every space horror movie ever? Will there be coffee? Reasonable questions all, but in reality, another one you might want to ask is, will I be able to walk when I get back home? We know microgravity is hard on a body, and this mission is largely about testing the physical effects of being weightless for so long. Astronauts often experience things like trouble sleeping, puffy faces, and loss of muscle mass, but perhaps the most serious damage a microgravity environment causes is to the bones. And bones, well, they're pretty clutch. So they may look all dried up and austere. Don't be fooled. Your bones are alive. Alive, I tell you. They're actually as dynamic as any of your organs and are made of active connective tissue that's constantly breaking down Your bones do way more than just providing your squishy sack of flesh with support and scaffolding and the ability to move around. Your bones are basically how you store the calcium, phosphate, and other minerals you need to keep neurons firing and muscles contracting. They're also crucial to hematopoiesis, or blood cell production. All of your new blood, and we're talking like 1 trillion blood cells a day, is generated in your bone marrow, which also helps store energy as fat. Bones even help maintain homeostasis by regulating blood calcium levels and producing the hormone osteocalcin, which regulates bone formation and protects against glucose intolerance and diabetes. So the big buzzkill about life in space is that up there, a person suffers 1 to 2% bone loss every month. By comparison, your average elderly person experiences 1 to 2% bone loss every year. So for Kelly and Kornienko, that could mean losing up to 20% over a year in orbit. Given everything your bones do for you, that's really serious. And while most of that loss is reversible once they're back on Earth, it's not as easy as chugging some of Madame Pomfrey's Skelegro potion. Rehabilitation can take years of hard work, and that's after just a few months in orbit, which is why Kelly and Kornienko are heroes of science, and not just for scholars of anatomy and physiology everywhere, but for anybody who has bones. An average human body contains 206 bones, ranging in shape and size from the tiny stapes of the inner ear to the huge femur of the thigh. That's a lot of bones to keep tabs on, so anatomists often divide these structures first by location into either axial or appendicular groups. As you might guess, your axial bones are found along your body's vertical axis in your skull, vertebral column, and rib cage. They're kind of like your foundation, the stuff you can't really live without. They carry your other body parts, provide skeletal support and organ protection. Your appendicular bones are pretty much everything else. The bones that make up your limbs and the things that attach those limbs to your axial skeleton, like your pelvis and shoulder blades, these are the bones that help us move around. From there, bones are generally classified by their shape, and luckily those names are pretty obvious. Long bones are your classic-looking dog bone-shaped bones, the limb bones that are longer than they are wide, like the tibia and fibula of your lower legs, but also the trio of bones that make up your fingers. Follow some of those long bones to your foot or hand, and you'll hit a cube-shaped short bone like your foot's talus and cuboid, or your wrist's lacunate and scaphoid. Your flat bones are the thinner ones like your sternum and scapulae, and also the bones that make up your brain case. And your irregular bones are all the weirdly shaped things like your vertebra and pelvis, which tend to be more specialized and unique. But despite their variations in size, shape, and finer function, all bones have a similar internal structure. They all have a dense, smooth-looking external layer of compact or cortical bone around a porous, honeycomb-looking area of spongy bone. This spongy bone tissue is made up of tiny cross-hatching support supports called trabeculi that help the bone resist stress, and it's also where you typically find your bone marrow, which comes in two colors, red and yellow. Red marrow is the stuff that makes blood cells, so you should be glad that you have some of that, and yellow marrow stores energy as fat. If you happen to be a predatory animal, yellow bone marrow can be one of the best sources of calories you can find. The arrangement of these bone tissues, though, can be slightly different from one type of bone to the next. In flat, short, and irregular bones, for example, these tissues kind of look like a spongy bone sandwich on compact bone bread. But in some of your classic long bones, like the femur and humerus, the spongy bone and its red marrow are concentrated at the tips. These flared ends, or epiphyses, bookend a bone's shaft or diaphysis, which instead of having spongy bone in the center, surrounds a hollow medullary cavity that's full of yellow marrow. Now, although bone can look rock solid, grab a microscope and you'll see that it's actually loaded with layered plates and laced with little tunnels. It's intricate and kind of confusing in there, but the more you zoom into the microanatomy of bones, the better you can see how they're built and how they function right down to the cellular level. Let's start with the basic structural units of bone called osteons. These are cylindrical weight-bearing structures that run parallel to the bone's axis. Look inside one and you'll see that they're composed of tubes inside of tubes, so that a cross-section of an osteon looks like the rings of a tree trunk. Each one of these concentric tubes or lamellae is filled with collagen fibers that run in the same direction. But if you inspect the fibers of a neighboring lamella, either on the inside or the outside of the first one, you'll see that they run in a different direction, creating an alternating pattern. This reinforced structure helps your bone resist torsion stress, which is like twisting of your bones, which they experience a lot, and I encourage you not to imagine what a torsion fracture of one of your bones might feel like. Now, bone needs nourishment like any other tissue, so running along the length of each osteon are central canals which hold nerves and blood vessels. And then tucked away between the layers of lamellae are tiny oblong spaces called lacunae. As tiny as they are, these little gaps are where the real work of your skeletal system gets done, because they house your osteocytes. These are mature bone cells that monitor and maintain your bone matrix. They're like the construction foreman of your bones, passing along commands to your skeleton's two main workhorses, the osteoblasts and the osteoclasts. Osteoblasts, from the Greek words for bone and germ, or sprout, are the bone building cells, and they're actually what construct your bones in the first place. In the embryonic phase, bone tissue generally starts off as cartilage, which provides a framework for your bones to grow on. When osteoblasts come in, they secrete a glue-like cocktail of collagen, as well as enzymes that absorb calcium phosphate and other minerals from the blood. These minerals form calcium phosphate, which crystallize on the cartilage framework, ultimately forming a bone matrix that's about 1/3 mineral, 2/3 protein. From your time in the womb until you're about 25, your osteoblasts keep laying down more collagen and more calcium phosphate until your bones are fully grown and completely hardened. So while your osteoblasts are the bone makers, your osteoclasts are the bone breakers, which is a kind of violent image. Maybe think of them as like a bone breaker downer. Although the two kinds of cells do exact opposite jobs, they're not mortal enemies. In fact, I'm happy to report that they get along fabulously and create a perfect balance that allows your bones to regenerate. It's like if you want to renovate your house, you gotta rip out all those busted cabinets and the musty carpeting before you can bring in the nice hardwood floors and custom countertops. These cells work in a kind of similar way, in a process that I'd argue is less stressful than home improvement. It's called bone remodeling. The supervisors of this process are those osteocytes, which kick things off when they sense stress and strain or respond to mechanical stimuli, like the weightlessness of space or the impact of running on pavement. So say you're out running and something happens, nothing to be alarmed about, but suddenly the osteocytes in your femur detect a tiny microscopic fracture and initiate the remodeling process to fix it up. First, the osteocytes release chemical signals that direct osteoclasts to the site of the damage. When they get there, they secrete both a collagen-digesting enzyme and an acidic hydrogen ion mixture that dissolves the calcium phosphate, releasing its components back into the blood. This teardown process is called resorption. When the old bone tissue is cleaned out, the osteoclasts then undergo apoptosis, where they basically self-destruct before they can do any more damage. But before they auto-terminate, they use the hormone hotline to call over the osteoblasts, who come in and begin rebuilding the bone. The ratio of osteoclasts to osteoblasts can vary greatly, and if you stress your bones a lot through injury, by carrying extra weight, or just normal exercise, those osteoclasts are going to be swinging their little wrecking balls nonstop, breaking down bone so it can be remade. In this way, exercising stimulates bone remodeling and ultimately bone strength. So when you're working out, you're building bone as well as muscle. Which brings us back to our two space heroes / guinea pigs, Scott Kelly and Mikhail Kornienko. Space crews generally need to exercise at least 15 hours a week to slow down the process of bone degradation, but even that can't fully stave off loss of bone density. In microgravity, osteocytes aren't getting much loading stimuli because less gravity means less weight. But for reasons that we don't understand yet, the osteoclasts actually increase increase their rate of bone resorption in low gravity, while the osteoblasts dial back on the bone formation. Because there's more bone breaking than bone making going on, everything is out of balance, and suddenly people start experiencing 1 to 2% monthly loss in bone mass. So in addition to providing astronauts with oxygen and water and food and protection from radiation and an environment that will keep them mentally stable, it turns out that we also have to figure out how to keep their bodies from consuming their own skeletons. But at least today we learned about the anatomy of the skeletal system, including the flat, short, and irregular bones and their individual arrangements of compact and spongy bone. We also went over the microanatomy of bones, particularly the osteons and their inner lamella. And finally, we got an introduction to the process of bone remodeling, which is carried out by crews of osteocytes, osteoblasts, and osteoclasts. Special thanks to our headmaster of learning, Thomas Frank, for his support for Crash Course and free education. And thank you to all of our Patreon patrons who
Need come anytime. This is special.
Every day I wonder, and I dream of it every
that you guys are not 5 years old. If you were all in, like, kindergarten, the only way I could teach you about your skeletal system would be to sing you that stupid song. You know, the toe bone's connected to the foot bone's connected to the ankle bone's connected to the leg bone. Like, apparently there's one leg bone. For the purposes of teaching college-level anatomy and physiology, let's just say that that song is reductive, insufficient. For that song to be at all useful for remembering all 206 bones that make up your skeletal structure, it would have to begin with something like the distal phalanx is connected to the middle phalanx, and then end with something like the frontal bone meets the parietal bone along the coronal suture, and it would probably take like 2.5 hours to sing the whole thing. But there is way more to know about your skeletal system than just the names of the bones. In addition to bones, there's cartilage and fibrous connective tissue that allows them to work together, and maybe more importantly, if you're going to talk about the physiology of your skeleton, you have to talk about joints. Joints are the meeting places between two or more bones, and even though it might not sound mathematically possible, you actually have more joints in your body than you have bones. In a lot of places, like your hands and feet, each individual bone is part of more than 1 or 2 joints. And then there's the matter of what all that bone, cartilage, connective tissue, and the joints that they form actually work together to do. And that is move. Body movements happen when muscles contract across joints, moving one bone toward another, and studying the different types of movements your body is capable of is not only pretty fun, it's also one of the best practical ways to understand your bones and joints. If you ask me, all that is infinitely more interesting than memorizing what goes where and pretending like a backbone is really an anatomical structure. So, aren't you glad you're a grown-up? Don't worry, it's not anyone you knew. It's plastic, and it's a little bit smaller than the average adult skeleton. But other than having me stand in front of a giant x-ray machine for 10 straight minutes, I can't think of a better way to walk you through the major anatomical structures of your skeleton. Now, if you managed to retain our introduction to human bones last week, you'll recall that anatomists typically divide the skeleton into 2 major parts, the axial and the appendicular. The axial structure includes all 80 midline bones that form your skull, vertebral column, and thoracic cage. Starting at the top here, your skull's 8 cranial and 14 facial bones form your body's most complex bony structure, coming together to do some pretty great things like protect your brain, help you see, smell, hear, eat, and, you know, have a face. The 33 irregular bones in your vertebral column start with your atlas vertebra, the one that holds up your skull and is named for the Greek god Atlas, who held the world on his shoulders as a punishment. I'm not saying you got a huge head or anything, I'm just saying that's what it's called. The vertebrae run down from your skull to your pelvis, providing the central support for your upper body and completing the enormously important job of protecting your spinal cord, the main communication line between nearly all of your body and your brain. Most of your vital organs are protected by the 12 pairs of ribs and dagger-like sternum that together comprise your thoracic cage, which also provides attachment points for your back, chest, shoulder, and neck muscles. Now, the appendicular skeleton includes your upper and lower limb appendages and pectoral and pelvic girdles that attach to the axial skeleton at the shoulder and the thigh. And even though your arms and legs clearly serve different functions, unless you spend a lot of time walking around on your hands or picking stuff up with your feet, both sets of limbs share a similar setup. They're each composed composed of 3 major segments, a common arrangement we see in loads of animals all the way back to fish, which anatomists refer to as 1 bone, 2 bones, lots of bones and digits. We can't all be Dr. Seuss. And that's just about enough anatomy for this plastic skeleton to pay for itself. I'd rather focus on the physiology of the skeleton, and in order to do that, we gotta talk about joints. As is often the case in anatomy, we classify joints both by what they're made of and by what they do. Because form follows function, we can't really talk about one without talking about the other. So the structural classification of your bones is all about what kind of material binds those bones together. Like, is it a fibrous tissue or cartilage or a special fluid-filled joint cavity? But the functional classification focuses on how much that joint can move. So for example, you have joints in your body that don't move at all. These include, say, the joints between the bones that make up your cranium. These non-moving joints are called synarthroses. But you also have joints that move only slightly, like the spot where your 2 pubic bones meet to form your pelvis. That joint exists mainly to absorb shock from walking and running, but it also has proven very handy during things like childbirth. These partly moving joints are called amphiarthroses. Finally, there are the diarthroses, which are fully movable, like your classic knee and elbow joints. They're mostly found in your limbs. But if you eventually find yourself in the business of examining and treating people's joints, and there are a lot of doctors who do, then it'll be especially useful to know the structural classifications. Structurally speaking, you've got fibrous, cartilaginous, and synovial joints. Fibrous joints connect bones with dense fibrous connective tissue and are mostly immovable, like those sutures between your skull bones. As you might guess, your cartilaginous joints unite bones using cartilage and are similar to their fibrous brethren in that they don't move very much and they lack a joint cavity. But the family of joints that make all the sports and the entire art of breakdancing and yoga possible are the freely movable synovial joints. Most joints in your body fall into this category. Although they do make use of cartilage and fibrous connective tissues like ligaments, they're different in that the bones they join are separated by a fluid-filled joint cavity. The cool thing about these cavities is that they contain a bit of viscous, egg white-like synovial fluid that acts like grease on a hinge. Without that lubricant, just running down the street could cause enough friction not only to wear out your joint surfaces, but actually overheat your joints enough to essentially cook the surrounding tissue and leave your legs smoking like a desperate Looney Tunes character. These freely movable synovial joints come in 6 different configurations that together allow pretty much any movement your body can make, from a subtle head nod to a vigorous jumping jack, all of which you will find in action at your typical dance party. Seriously though, dance parties are an excellent place to study skeletal physiology. I mean, let's just take this from my perspective. I'm at my high school prom. I'm wearing a tux that is really uncomfortable and I'm feeling kind of shy standing on the edge of the crowd. Maybe I want to test the waters out a little bit with like a little hand dancing, just a hand going, waving my hand from side to side. It's a type of gliding movement, one that occurs when one flat bone surface glides over another. All these motions use gliding or plane joints like the one between the distal ends of your radius and ulna and the carpal bones of your wrist. But say after a while, I feel like these gliding movements just aren't enough to fully express myself. I have to enlist the more versatile angular movements. These are the types of motion that either increase or decrease the angle between 2 bones across any plane in the body. Like if I bob my head or kick my leg up or raise the roof. If people still do that, if that bending motion decreases the angle of the joint and brings those bones together, like when I bend my arm together, that movement is called flexion. When I bend it back, I'm increasing that angle, and it's called extension. And if I continue that motion beyond my normal anatomical positioning, and it's somewhat dangerous, that is called hyperextension. These motions enlist the hinge joints. Similarly, my oval-shaped condylar knuckle joints allow my fingers to bend and ball up for a good fist pump. Now I'm getting super into it. I might like raise my arms up over my head, while the act of raising my arms away from my body is called abduction, while moving them back down toward the body is called adduction. And this here like lasso movement, that's circumduction, a combination of all 5 of those movements that allow the forearm to move in a circle while the elbow joint stays relatively stable, which really makes you want to give credit to those cowboys. Now if you want to get really serious about that lassoing and expand it to include the entire arm, the move eventually will morph from an angular movement to a rotational one, a motion that turns the bone around its axis, in this case, the humerus. Hip and shoulder joints use a ball and socket design that allow rotational movement, but the more flexible a joint is, the more unstable and fragile it is, which is one reason why you see so many dislocated shoulders and hip replacements. And it's worth pointing out that some movements are just special and unique and weird and only occur in a few select joints, especially in your hands, feet, and jaw. For example, your ability to touch your thumb to your fingertips or give a thumbs up is thanks to opposition movement facilitated by your saddle joint, which makes your thumbs opposable. The pivot joint between your radius and ulna allow you to rotate your palm forward or anteriorly in a motion called supination, and turning it backward or posteriorly is called pronation. So that's what I like to think is the more grown-up approach to teaching you about your skeleton. It did not involve any singing, but yes, a little dancing. And it was worth it because you learned about the basic structure of your skeletal system, including the arrangements of both the axial and the appendicular skeleton. And we went over the structural and functional classifications of your joints, along with the major types of movement that they make possible. Special thanks to our headmaster of learning, Thomas Frank, for his support for Crash Course and free education. This episode was
So we are done with the skeletal system, right? We have watched the video and everything. Let us start a little bit with the last one for our course, which is the 10. Now it's the muscular system. Probably this also has 100 something, 130. Okay. So let us start with that. What is the muscular system? The muscles, which are responsible for all types of body movement. So muscular system. We have already told that we have three basic types of muscles: skeletal muscle, cardiac muscle, and smooth muscle. So what are those? Skeletal muscles and smooth muscles are elongated cells. They can do the contraction and shortening of the muscles by the movement of the microfilaments. What is the prefix for the muscle? Remember, myo or mis refer to muscle. Also, there is another prefix for the muscle which is called the flesh. Sarco, this sometimes comes. Prefix for flesh, sometimes students make a mistake called the myo or mis. Flesh is sarco, note, but muscle either myo or mis. So muscles are different units as usual. Composition, let us see what are the different characteristics of the different muscle system and where they find it. This slide is very concise and important to get all the information basically for the muscle system. The skeletal, it's from the name we can, skeletal is mainly associated with the skeleton, so attached to bone or skin for some facial muscles also. This is skeletal muscle. What are the cells looks like? These are the single cells. So these are the long and cylindrical muscles. Skeletal muscles are striated but multinucleated. Note all these points. And what are the connective tissue component? Endomysium, perimysium, and epimysium. These are the connective tissue. We will see the structure later. So, first of all, skeletal muscle mainly attached to skin or bone and the facial structures. These are the long, cylindrical, multinucleated, and striated. Okay, and it has three connective tissue. Now, cardiac, from the name cardiac, is understood that is related to heart. So, where you can find it? You only kindly find it in the walls of the heart to help in the movement or pumping action of the heart. These are the uninucleate, one cell, skeletal, multinucleate, cardiac, single, uninucleate or single cells. It has striations and intercalated discs. The connective tissue is only endomysium type. And what is smooth muscle cells? Smooth muscle cells are generally covered all the associated with the internal organs, visceral organs, other than heart. Heart is only cardiac muscle. Apart from that, all other lines, structures, everything is associated with the smooth muscle. These are the single fusiform and single one nucleus. So there are single or uninucleated or one nucleus in two types of muscle. One is cardiac, one is smooth. Okay. Cardiac muscles uninucleated but has striations. Smooth muscle cells single uninucleated but no striations. And both of them only have the endomysium. So these are the difference. Is going to come single cell, uninucleated, no striations. Smooth muscle cells are uninucleated, yes or not? Smooth muscle cells has striations, true or false? Same thing like the other cardiac. Is a uninucleated, but it has the striations. So that the smooth muscle cells uninucleated but no striations. Okay. So now regarding the functional part, which muscles do what type of function? Skeletal muscle is volatile as it is connected with the skeleton. So whenever you need, you can move. So it's called the voluntary. Cardiac muscles, you cannot control the movement. Heart's pump in and out, you cannot control what function. Smooth muscle cell, which is present in the internal organs mostly associated with that, it's involuntary because you cannot control. If there is any inside, you need a movement of anything like the stomach movement or urinary when you are feeling the urine or heart, those is involuntary. You cannot control it. So that's why only skeletal muscle is voluntary. Cardiac and smooth muscles are involuntary. Speed of contraction, skeletally slow to fast, depending upon your movement. Cardiac, in generally slow pace, how it works in the body. But smooth muscles are very low. Skeletal muscles has no rhythmic contractions because when you are doing it, it's working. If you're sitting, not doing movement or anything, there is no activity. But cardiac muscles is always non-stop working. So it has a rhythmic pattern of the contraction and relaxation. Smooth muscles is not always, but some of them, like the stomach and other things where it has your own rhythmic patterns. But there are some places where they has no activity for the contraction and relaxation until any emergency comes. So most muscles are attached tendon to bones. This is important. What the tendon and ligament. Ligament, write down. Ligament attachment bone to bone. Tendon attachment muscles to bone or bones to muscles, vice versa. Tendon, once again, tendon attached bones to muscle or muscles to bone, whereas ligament is helping an attachment between bone to bone. In general, cells are multinucleated, striated, have visible banding. This is the skeletal muscle. Attach tendons to bone. As I told before, it's multinucleated, it's striated. That means visible banding is there and it's a voluntary. That means whenever you need or you are using is doing that. So what are the connective tissue wrapping the skeletal muscle? There are inside this endomysium encloses single muscle fiber. Perimysium wraps around a bundle of muscle fiber, and epimysium covers the entire skeletal muscle. These are the different parts. And what is the fascia? It's the outside of the epiphyseum. See, if we go like this, the structure, you can see this is the perimysium. This is the endomysium. And this is including everything is epimysium, the outside. And then it's going to form a tendon when it's attaching the bone. So epimysium blends into connective tissue attachment. Tendons, these are the cord-like structure. It again, once again, I repeat, it connects the muscles to bone. So these are mostly collagen fibers. So these are the stretchable property. Often cross a joint due to toughness at small size. So it said attach muscle indirectly to the bones. These are called the aponeurosis. You doesn't need to know. This will not count, but as cartilage or connective tissue coverings. What are the sites of muscle, skeletal muscle attachment? Bones, cartilage, and connective tissue coverings. Sites of muscle attachment. These three are, it can be attached to bone, it can attach to bones to cartilage, or cartilage to bone, or some connective tissue covering. Now we are going to learn about the smooth muscle characteristics. We already discussed in that, what is called, precise slide. So smooth muscle doesn't have any striations, right? Skeletal muscle has, cardiac muscle has, but no striation means no visible strand. These are kind of spindle shaped, and these are single nucleus. Skeletal muscles multinucleated. These are the involuntary, no conscious control. Where they can found? They are found mainly in the walls of hollow organ. So these are the structure, how it looks like. This kind of spindle shape, that is important to see. Now cardiac muscles is related to the heart. It has striations, but it is single nucleated, uninucleate. Only one nucleate can serve the function. So what is has? It has striations, single nucleus, branching cells, and joined to another muscle cell at an interconnected disc, so that it has the shock absorption procedure. Involuntary muscles, these are nature involuntary. You cannot control them. And it is found only in the walls of the heart. The total single nucleus striations are there, branching cells, another muscle cell at an intercalated disc without, and it's involuntary in nature, so you cannot control this movement, and mainly and only found in the walls of heart. So the anatomy is going to be striations and other things you can see there, but how the cardiac muscle fibers are tightly attached to here. So what are the functions of the muscles, different types of muscles? Skeletal muscles produce movement, maintains posture, stabilize joints, and generate heat. This from our common thinking is voluntary. Obviously, it produces the movement. And if the progressive movement, it is attached to all the skeleton. So it's going to maintain the posture. Obviously, the skeletal muscle stabilizes the joint also. Even if you just stay on the bone, is that going to stay? No, you need some connection, some stabilizing support. So skeletal muscles help in stabilizing the joint and it generates the heat. Because during movement, you need the heat. So it generates the heat. Pain. So what is the microscopic structure of the skeletal muscle? It's not going to come every moment points. If there is any important, I'm going to highlight you. So basically, it has couple of layers. Sarcolemma is the plasma membrane. Myofibrils, long organelles inside the muscle cells, and sarcoplasmic reticulum, specialized muscle and endoplasmic reticulum, what you have learned before. So basically, it looks like this one. This is called the sarcolemma. This is the nucleus of a muscle cells. This is the light band. This is the dark band. So, and you have a nucleus outside. So these are called the myofibril individual structure. So myofibrils are aligned to give distinct bands, I bands, and A band. It's called the dark bands and light bands. These two bands are mainly responsible for the movement of the muscle. When the muscle moves, these two members, along with the other, like the cardiovascular system, your nervous system, so and any extra things, they are going to help in the muscle movement using the I band and A band. So here is that. This is called the I band and this is called the A band. I band and A band. There's an alternate I band and A band. I band and A band. What is the sarcomere, contractile unit of a muscle fiber? So it looks like the huge muscle, but there is a unit which contracts and it passes the information and then the progression of the movement takes place. So who starts that? Who is responsible is a sarcomere, is a contractile unit of a muscle fiber. So this has myofilament. In the filament, they come the thick filaments and thin filaments. What is the name of the thick filaments? Is the myosin, and the thin filaments is the actin. So basically, they have the microanatomy. So they have the myosin and actin are the main filaments of the muscle fibers. Doesn't need that much. So just to show that how the thick and thin elements can arrange among themselves and they are interrupted. When the muscle contracts, they do the slide movement here to move that one. That's why this space is there. It's called the M line and this zone is called the Z zone or this zone. What? So it looks like that. This is the zone where there is no nothing. So thick filament, thin filament. Here the actually gliding movement of the muscles takes place. Gliding, sliding, whatever is that. Okay, so now let me go a little bit up and do a little bit less zoom. Okay, now what are the different phases of muscle contraction of a skeletal muscle? Excitability or called responsiveness to irritability. When it receives and responds to a stimulus. Contractility, when it receives the stimulus Thin muscles have to shorten when the adequate stimulus is received and they relax. Shorten and relax. Shorten is called the contraction and relaxation. Contract and relaxation. That helps you to move. Extensibility, ability with the muscles to be stretched. How long it is going to stay stretched? If you put your hand up and stretch, so how long it is going to be stretched? That's the extensibility. And elasticity, ability to recoil and resume resting length. So when you stretch, after that you are bringing it bounce at the elasticity. So excitability, contractility, extensibility, and elasticity. So for doing any action, skeletal muscle must stimulated by a motor neuron nerve cells to contract. So what is the motor unit? One motor neuron and all the skeletal muscle cells stimulated by the neuron. That is the motor unit. One motor neuron, one neuronal cells which is responsible for stimulating that skeletal muscles is called the motor unit. So how is connected with the different, this is the neuron, is getting the signal and then it's going to the muscle, then muscle start taking the information and start moving. So what type of different junctions we have? We have another junction, is called the neuromuscular junction, where the axon terminal of the motor neuron, because nerves are also coming. It's not only the muscle means muscle. For the doing the muscle function, you need the muscle, you need the nerve, you need the attachment. So where the point neuron is attached, neuron, the axon terminal, we are going to learn later what is the axon terminal of a neuron, but it's the one terminal of neuron and the muscle, the site where it acts, that is called the neuromuscular junction. So this is the video link. If you want to see, you can see what is the neuromuscular junction. So see, this is the neuron, this is the axon, and is getting sitting on the muscle. This is called the neuromuscular junction. This way, any stimulus comes, the stimulus pass to the muscles, and then it started contraction and relaxation as per the need. What is called the synaptic cleft. This doesn't need it. I'm just telling you. The gap between nerve and the muscle. This is called the synaptic cleft. The gap between the nerve and the muscle. So nerve and muscles do not make contract. Area between the nerve and muscles is filled with interstitial fluid. This area always, the whole body is full with interstitial fluid. Oh, these are too much for you guys. Just know what is the neurotransmitter. Neurotransmitter, which the chemical things which transmit the message from the neuron to the muscle or anywhere. Neuron to the when any chemicals from the neuron brings and transmit the message, that is called the neurotransmitter. In scale up muscle action, what happens from the neurons, as in case of skeletal muscle function, from the neurons here. From the neuron, the chemical is named acetylcholine. It has been released from the axon terminals to the neuromuscular junction, and that acetylcholine is going to take action for doing the opening channels and ultimately movement of the muscles. That is the easy way I can tell you. We are going to watch the video later. No, no, no. No, these are too much. He said, who does the research for them is good. So just give a little bit idea that nerve, you know, the neuron is coming. This is the axon terminal. It releases, this is the neuromuscular junction. It releases the acetylcholine. And then when the acetylcholine is released, there are a lot of chemical reactions is going on. Sodium is going in, potassium is going to come out, stimulate the signals, and then probably from the thick and thin filaments muscle fibers started contracting and relaxation. Oh. These were not before. Now they've added all these things. These are useless. To make it short, let me go to a video if it's going to be useful for you, but I don't think there is a need of this one. Okay. What is this one? Neuromuscular junction. Is there any video before? It's much better to see in the video. Let me see if we can copy. Oh, I can play it from here? No? Why you cannot play it? Play it here. Oh. YouTube. Let me put this one. Because flashcard video. This is 1 year ago. Let us do this one.
For students living in low-income communities, high school graduation opens doors to a world of opportunities. But the most important doors are the ones that stay open behind us. We call it the graduation effect.
A skeletal muscle contracts only when stimulated by nerve impulses from a motor neuron.
You can
Without
hear?
innervation,
You guys
muscles
can
become
hear?
paralyzed and eventually
Yes, miss.
atrophied. The axon of a motor neuron usually gives out many branches, supplying multiple muscle fibers. These fibers contract in unison when activated and constitute a motor unit. A motor unit can contain anywhere from just a few muscle fibers to thousands of them. Small motor units are found in muscles that require finer control. For example, muscles that are responsible for subtle movements of the eyes. Large motor units are found in larger muscles that require strength, such as muscles of the arms and legs. Muscle fibers of the same motor unit are usually not clustered together, but scattered throughout the muscle. This way, stimulation of a motor unit has a slight but uniform effect on the whole muscle, and not causing a small, localized twitch. The strength of a muscle contraction is determined by the number of motor units that are activated at one time. Even at rest, most muscles are in a partial contraction state called muscle tonus, which is maintained by alternating activation of a small number of motor units. The connection between a motor neuron and a muscle fiber is called a neuromuscular junction, which is basically a chemical synapse between the nerve terminal and a specialized area of muscle cell membrane called the motor end plate. When an action potential reaches the nerve terminal, it causes the release of the neurotransmitter acetylcholine into the synaptic space. Acetylcholine then binds to nicotinic receptors on the end plate. Nicotinic receptors are ligand-gated ion channels. Upon binding to acetylcholine, they open to allow sodium to enter the cells, depolarizing the cell membrane, producing the so-called end plate potential. An action potential is generated in the muscle cell only when the end plate potential reaches the threshold required to activate voltage-gated sodium channels located outside the end plate in the neighboring membrane. When activated, these channels allow faster influx of sodium, further depolarizing and eventually reversing the polarity of the cell membrane. At this point, voltage-gated potassium channels open for potassium to move out, quickly returning membrane voltage to its original resting value. Once generated, the action potential spreads like a wave, thanks to similar voltage-gated ion channels located throughout the muscle fiber. The action potential also runs deep into the fiber via T-tubules to reach the sarcoplasmic reticulum. Here it activates voltage-gated calcium channels, releasing calcium from the sarcoplasmic reticulum into the cytosol of muscle cells. Calcium then sets off muscle contraction by the sliding filament mechanism. This mechanism is described in another video. Another important component of the neuromuscular junction is the enzyme acetylcholinesterase. This enzyme removes all acetylcholine molecules that do not immediately bind with the receptor and those that are done activating a receptor. The enzyme action essentially terminates synaptic activation, giving the muscle time to relax and thus preventing continuous contraction that would result in muscle spasms. Substances that cause muscle weakness or paralysis do so by interfering with the function of neuromuscular junction. Botulinum toxin prevents acetylcholine release from the presynaptic side of the junction. Some other toxins attach to nicotinic receptors, blocking acetylcholine from binding but do not open the ion channel. Certain drugs lodge into the channel of nicotinic receptor, blocking the passage of sodium. All these substances prevent activation of muscle cells and cause flaccid paralysis. On the other hand, some pesticides inhibit acetylcholinesterase, preventing degradation of acetylcholine, causing continuous activation of muscles. That's how they induce muscle spasms and cause spastic paralysis.
Okay. Thank you. Okay. Then we have another video. I saw this one. This is complicated, right? Who doesn't need to know all these things? Let me go to see another video for the muscle movement. This one, the cross bridge cycle. My God, there are two. No.
The contraction of a skeletal muscle generates the force necessary to move the skeleton. A contraction is triggered by a series of molecular events known as the cross-bridge cycle. In a skeletal muscle fiber, the functional unit of contraction is called the sarcomere. A sarcomere shortens when myosin heads in thick myofilaments form cross bridges with actin molecules in thin myofilaments. The formation of a cross bridge is initiated when calcium ions, released from the sarcoplasmic reticulum, bind to troponin. This binding causes troponin to change shape. Tropomyosin moves away from the myosin-binding sites on actin, allowing the myosin head to bind actin and form a cross bridge. Also note that the myosin head must be activated before a cross bridge cycle can begin. This occurs when ATP binds to the myosin head and is hydrolyzed to ADP and inorganic phosphate. The energy liberated from the hydrolysis of ATP activates the myosin head, forcing it into the cocked position. A cross-bridge cycle may be divided into 4 steps. Step 1. Cross-bridge formation. The activated myosin head binds to actin, forming a cross bridge. Inorganic phosphate is released, and the bond between myosin and actin becomes stronger. Step 2. The power stroke. ADP is released and the activated myosin head pivots, sliding the thin myofilament toward the center of the sarcomere. Step 3. Cross-bridge detachment. When another ATP binds to the myosin head, the link between the myosin head and actin weakens, and the myosin head detaches. Step 4. Reactivation of the myosin head. ATP is hydrolyzed to ADP and inorganic phosphate. The energy released during hydrolysis reactivates the myosin head, returning it to the cocked position. As long as the binding sites on actin remain exposed, the cross-bridge cycle will repeat. And as the cycle repeats, the thin myofilaments are pulled toward each other and the sarcomere shortens. This shortening causes the whole muscle to contract. Cross-bridge cycling ends when calcium ions are actively transported back into the sarcoplasmic reticulum. Troponin returns to its original shape, allowing tropomyosin to glide over and cover the myosin-binding site on actin.
So you can understand troponin, why troponin is so much important for any muscle function, especially the cardiac. Okay, so this one we did the contraction of muscle cells, everything is done. Okay, types of gated response, twitch. They told you the twitch means single. Sometimes you say that we call the muscle is single beat contraction. It's not a normal muscle function. What is twitch? That is also important. Okay. Devices, okay. So this is the summingum contraction. You already saw that the video. So from the video is easy instead of slides. You want me to repeat it?
No. Do you find this a little excessive?
Yes.
Yeah.
You can see from my tone which is excessive, which is not.
Yeah.
So this is important.
ATP.
ATP. Okay. ATP is needed for the muscle function. Okay, because ATP gives the energy for doing the muscle contraction or the muscle movement. So ATP is stored for energy. ATP bonds are broken to release energy, and that's all. It doesn't need anything. Only the ATP is the main source of muscle contraction or muscle function. Okay, that's the main thing. My God. Oof. Okay, so we are almost done. So I am going to leave it here because guys need some time to. This is too much to study. So you doesn't need these things. My goodness, only this slide is okay. 58. What is the 59? Direct phosphorylation. These are all the research topics. Creatinine, phosphate, high energy molecule. These questions are not going to come anyway. So we are going to round up these things, whatever is the left, and probably you guys can do some. I will guys ask you to generate some review questions for you guys now this time. I am tired. You guys can do this one. So this slide is going to be lactic acid. Okay, so this one. So we are going to start from slide 58. We did the 58. We'll start the 58, 130. Most of the slides are useless. Sorry to say that. Yeah, but we'll start from there, and then you guys going to do the extension review tomorrow. And I'm going to, when you are going to study, I'll make some. You will study at the same time. You can generate some review questions for yourselves, and I am going to work tomorrow for making your review questions too. Okay.
Okay, sounds
Okay,
good.
thank you.
And then Monday we are going to take the exam, and after the exam, it's not a big exam. The course is huge. It's 40 minutes or 50 minutes exam, and see how many information you guys have to know. Anyway, I try to jot it down as much as possible, but I have to teach whatever is the PowerPoint. So with the giving the emphasis and giving the more focus on the whatever is really needed for your exam as well as your profession, I'm trying to put it out, and hope it's going to good for you. And just do the studies, review the studies. Is 1 hour. It's good for you guys to do the studies and notes, whatever I told, tally with them. And yes, and then we'll go from there tomorrow. Okay. Okay.
Okay.
Excuse me.
Sorry, did you say you're gonna give us the review tomorrow?
Yeah, I will work when I will close this chapter, complete this chapter. Then you are going to do your study at the same time. I start working already on the review. It takes time, right? Because there's so many things. So I'm going to complete the review and I will send it for the weekend.
Okay.
Okay.
And
Okay,
then
thank
you told that you want to do the exam on Monday. Is that right?
Yes.
Yeah.
Okay, so you are going to do the exam on Monday. So by this weekend, you are going to give all the. Okay, one thing, because as one student didn't take the exam, I'm going to send you the answers for the ethics final exams. You did the exams, you did good, but till I'm going to send the answers to the ethics final exams. Remind me, so that if anyone has did any mistake, whatever mistakes, it's not everybody got the 100%. What are the mistakes you did, so you can keep in your file with the questions and answers. Okay, so that for your future studies and future knowledge.
Okay, thank you. That's
Okay.
probably necessary for Melpal certification.
Yeah, and yeah, it's needed for your midterm exam, even for your final, midterm exam, your final exam here, then your ML
Okay.
Power exam here. Every time is needed because everything is going to be covered in the midterm. How much you learn till the midterm ends.
Yes, thank
So
you.
you guys, because I know you give the answer. Majority of you did very good, but not everybody did the 100%, and it's not expected though. But if you have the answers, you can find it out what you made the mistake, so that you cannot do the mistakes again. Okay. Okay.
Right.
Thank you.
Thank you.
Thank you.
Thank you.
Okay. So I'm going to up the microphone, and also of the stop sharing the screen because I have to work on the review. Okay.
Okay, thank
Okay.
you.
Okay.
Thank you.
Okay.
Thank
I'm not.
you.
I'm not leaving. Only the stopping the sharing the screen. And yeah. Okay. So.